Hello, and welcome to Menopause Sucks, but it doesn't have to. I'm your host, Juliana Garcia. I am a seasoned nutritionist and pro bodybuilder of 20 years. I've been a personal trainer for 20 years, and I have recently, in the last year and a half, have been going through perimenopause. And this journey has taken me into a deep dive of learning more about menopause and the menopausal woman's journey. It's definitely something that caught me by surprise. In today's episode, I'm going to be talking about symptoms. How do you know if you are actually in perimenopause? And if you are in perimenopause, what are the next steps that you need to accomplish? So that's what I'm going to be talking about today. This is a whole new topic for a lot of women who are going through this. And I say it's a new topic because what I mean by that is we're not really talking about this. We haven't been talking about it. Our mothers weren't talking about it. Our aunts weren't talking about it. This was something that when I started going through it and started receiving symptoms, I had no idea what was going on. I didn't know what my body was going through. I was very confused, especially because I've always been in control of my health. And when I say in control of my health, I eat healthy. I exercise. I competed as a professional bodybuilder for almost 15 years. And in that time, I learned so much that I'm very grateful of all the knowledge that I learned by going back to school and getting a nutrition degree because I had no idea how much food caused, how much of an effect food had on our bodies. So a lot of learning as I went through this journey as a pro bodybuilder. And it was exciting for me because I could feel my body, watch it grow lean muscle mass, and I could create this physique. As you can see in the back of my wall here, I could create this physique. Not sustainable, of course. So that is not something that you can sustain. It was a lot of work and a strategic refeeding plan afterwards so that I can go back to a healthy weight. However, I did learn a lot. And during this journey, I learned how to get my body into the best shape. And I've helped thousands of women get their bodies into peak performance, not just for competing, but for optimal reasons as well. And what I really love about knowing and understanding the body is just how much control you have over your health. Now, when I was younger and I was trying to bodybuild, I had different goals. Now, as a 48-year-old woman, my goals have changed. I'm not trying to get on stage again. I'm not going back, but I do want to be in the best shape that I perceive myself to be. And that can look different for everybody else. Everybody has their own particular goals, and it doesn't have to be for aesthetics. I know for me, that I want a strong and healthy body. And I'm going to share a story with you. About 3 years ago, I was on a vacation trip with my boyfriend and we were out ATVing and I got into a very bad accident. And this accident caused me to fall from at least a 20-foot cliff. And unfortunately, I have to admit, I wasn't wearing a helmet. I wasn't wearing anything to protect my body. And when I fell, I landed on the side, holding my head in my hands. I landed on the side of my body. I was not able to walk away from there. I was carried out of there, taken to the emergency room to find out that I had no broken bones, that I had a small fracture in my occipital bone right here in my left cheek. And I was so lucky. But the one thing that stuck with me was the doctor at the hospital in Mexico when he said, whatever you've been doing, don't stop doing it. And I truly believe that strength training, the fact that I've been strength training for all these years, it's strengthened my bones and my muscles to protect my body. Now, I'm not saying if you fall off a 20-foot cliff that you're going to survive and not break a bone, but that's what happened with me. And I can definitely claim that strength training has helped that. So with that being said, the things that I know and understand and I've learned over the years have brought me to a place where I can help women become stronger and optimal with their health, especially now during perimenopause. Now, when I started going through perimenopause, I started getting symptoms that I was really confused about. One of the biggest ones were moodiness and mood swings. Those were my top symptoms. But along with that, I was having an erratic period. It wasn't every 28 to 30 days the way it used to be. I was also having issues with my sleep. I was getting more tired more frequently. I was having brain fog. My libido started to decrease a little bit. So all of these things started adding up. And I can't pinpoint exactly when they started, around the time that they started. I mean, it was like one by one, little by little, they started accumulating. And I started doing my own research. And once I was online doing my research, I fell into perimenopause. I never even heard of the word perimenopause. And peri is around the time of menopause. So menopause is a moment in time when when you stop having your period for 12 months. You are postmenopausal. You're in menopause. Our menopausal journey is from perimenopause into postmenopause, and you're always going to be menopausal the rest of our lives. We're going to die being postmenopausal. And ladies, this is something we're not going to escape. Okay, it's not something you can go and take a pill for and it's going to go away. However, there are things that we can do for ourselves that can optimize our health and well-being, because during the time when I wasn't treating the root cause, which the root cause are our hormones start to decrease and fluctuate after the age of 35. And when they do that, our body starts acting erratically. We start getting these symptoms. So when our hormones, in particular, estrogen and progesterone, are the two that are going to fluctuate the most. And estrogen, that is the queen hormone that controls so many things. And when that starts to decline and go down, we start feeling all types of crazy symptoms. You'll even feel things like muscle cramps, pelvic and rectal pain, shortness of breath, shoulder pain, sleep apnea, double vision, dry eyes, dry mouth, and tongue. These are just many of the more than 100 symptoms that you could be experiencing. So don't dismiss them. So if you're going to your doctor, okay, and you let your doctor know that you have, these 8 to 10 symptoms, however many symptoms, and they dismiss you or they tell you this is normal or your blood is normal, then I would recommend finding another doctor, a doctor who will listen, a doctor who specializes in this. You can actually go to menopause.org and put in your zip code, and it'll find the specialists in your surrounding area. So that's a place for you to start. If your doctor is medically gaslighting you and they're telling you that you're in normal range, there's nothing, it's all in your head. It's not all in your head. Trust me. It's important that you speak up about your symptoms and you let them know where you stand, and you want to treat the root cause, which are our hormones. That is why we're having these symptoms. So other symptoms that we're having, I'm just going to read them off here. Things like memory lapse, loss, nightmares, panic attacks, rage, sleep problems, social anxiety, stress, abdominal pain, bloating, acid reflux. We've got flatulence, food allergies and sensitivities, food aversions, fatigue, low energy, frequent urination, loss or low libido, severe PMS symptoms, crawling sensations. Yes, crawling sensations on your arms, chills, clumsiness, changes in your sense of smell. These are all things that need to be noted and also be discussed with your physician or your specialist, your doctor. Ladies, it's so important that we go and we find somebody that's going to listen to us. So you've got to advocate for yourself, because this is not something that you should be feeling all the time. There is a way to alleviate these symptoms. And the way we do that is by treating, I'm going to say it again, I'm always going to say it, you want to treat the root cause. So how do you know you're in perimenopause? These are a ton of different symptoms. And the list that I'm looking at, I went to wearemorphous.com, and they actually have a whole list of symptoms. They're a great website where they have a great blog as well. And I love checking out their articles. You can check them out. And they can also give you a format on what to say and how to talk to your doctor. That's going to be coming up in the next podcast on how to go in and speak to your doctor and ask them if you are a candidate for hormone replacement therapy, if you are going through perimenopause. And remember, this is a decision that you get to make. You do not have to go the HRT route. I know there's a ton of misinformation out there, but ladies, it's time that we are informed and empowered so that we can make decisions about our health. I'm Coach Juliana. If you haven't already, please like, subscribe, share this with a female that you know that this could benefit. I want to start sharing my information with the community, and the more I can reach more people is when you start sharing. I'm Juliana. Thanks, and I'll see you in the next video.